Developmental anomalies of the tooth is today's lecture. We will only talk about the developmental anomalies of the tooth. There are many developmental anomalies in the tooth formation, while in embryonic stage especially many causes like genetic or environmental or trauma to the tooth, while in its developmental stage will cause the tooth to be malformed, or many anomalies will occur after its formation. Beginning with the disease called the dysplasia causing anodontia. Anodontia is a malformation in the tooth, or in fact missing tooth. It can be complete or focal. Complete or teeth are missing. Focal, some teeth are missing. Next anomalies, next malformation or problem with the teeth is called supernumerary teeth. Excessive amount of teeth are formed. This type of disease called also dysplasia, especially cleidocranial dysplasia. The one with the anomalies of anodontia was called ectodermal dysplasia, but this one is cleidocranial dysplasia or Gardner's syndrome, affecting the numbers, causing excessive numbers of the tooth. For the hypodontia or anodontia, most common types of teeth missing are third molars, maxillary, lateral incisor. For the supernumerary teeth, could be a fourth molar or a mesiodens is formed on the maxillary central, between the maxillary central incisors. Next, we move on to the, after we finish these diseases, that ectodermal dysplasia causing hair missing, nails and structures outside the derms, especially the teeth. We move on to the other kinds of division is between natal and neonatal teeth. Neonatal teeth, after month of or after birth, 1 month, 2 months, the teeth are formed to the patient. It could be supernumerary. And natal teeth, the supernumerary teeth or teeth, sometimes normal, sometimes many times having anomalies, are the teeth that are formed before the natal or before birth, called natal teeth. Next of teeth anomalies are macro and micro, this time of the, not the number but the size. Macrodontia, sometimes the arch maxillary or mandibular is small, causing a teeth to look larger than its original size, or a microdontia, hemihyperplasia, causing half of the arch, the teeth on the arch, whether maxillary or mandibular, to be larger in size. or sometimes when two teeth fuse together uh, during fusion, when two teeth in the bud stage are fused together, or after the formation of teeth, if there is a gemination causing the tooth to prematurely divide and causing what looks to like two fused teeth. There is also some type of gemination called concrescent. This one is the fusion of the teeth after the formation of the cemental parts. Next, we will talk about the microdontia, and this one occurs with pituitary gland dwarfism for patients having dwarf syndrome, causing the entire teeth to be small, or entire body to be smaller than the normal size. The teeth in this case might look smaller compared to the arch in some cases other than pituitary dwarfism, as the arch is larger than normal, causing the teeth to form spaces between the tooth and the other adjacent tooth. Let's move on to the next subject. Now, after we talked about the types, size, number of teeth, now we'll talk about the number of accessory cusps. These cusps are the cusp of Carabelli, most of the time are the maxillary molars. First molars is the most prominent site of this cusp of Carabelli. And there are other types of cusps that are formed at the anterior area. The cleoid cusps, half of the palatal part of the anterior area, lingually and anteriorly, at the anterior teeth. The cusp of Carabelli being at the mesio-lingual area. After we mentioned the cusps, now the cusp of Carabelli and the other type of cusp, which is the evagination cusp. Now we talk about the lesions that looks like the dental granuloma of the teeth. And this is the last subject of today. After it, we will finish this lecture. First type is evagination. A tooth, when it's in the embryonic stage, at the bud stage, there is a fold causing the evagination. Looks like a tooth inside a tooth. Invagination. Evagination is like a cusp formation, also in the bud stage of the formation of the tooth. After these, we will talk about the other type called the Enamel Therol. This one is could cause a problem with the if the patient has or having a periodontal disease, which will make the tooth hygiene harder to perform as the enamel is evaginated at the cervical area, or the dentino, the cemento enamel junction. Other type of cusps or enamel cusp presenting granuloma-like lesions will include Taurodontism. This one is when the tooth is having enamel malformation, and there are other two types of tooth enamel which will look like an enamel granuloma lesion. Thank you for listening to this lecture, and we hope to find more about this subject in the future.